So thank you guys for attending my presentation today. I greatly appreciate the time that you guys are willing to do this. And honestly, I had over 100 people register for this talk, and I was honestly just amazed by the fact that that many people wanted to come and listen to me talk, and that many people are going to listen to me talk about like the worst topic in the world, Cal OSHA and COVID combined. Like, honestly, I can't think of anything that I like least, but there's a lot of information to talk about. So I am really honored and happy that you guys are willing to do that. One thing I'm going to do first before I get started is I took this from Dr. Dave Nickel. If anybody heard him speak, he always does selfies with his audience. And I've been doing that a lot, both virtually and in person. And there's so many people on this call. What I would love to do is take a picture of everybody's faces. So if you have the opportunity to go off video for just a moment, you don't have to stay off, so I can get all your lovely pictures, lovely faces, and be so proud of this moment. So I'm going to count to 3, and then I'll go ahead and take the picture. So if you can get your video or face on so I can see it, and that would be awesome. All these wonderful people, thank you guys so much. Okay, so I'm going to try not to get my camera in the shot. So ready? I'm going to count to 3. 1, 2, 3. Smile, smile. Yay! Thank you guys so much. You're going to leave me with good memories. Well, maybe not, because it's the COVID presentation. So I don't know. Okay, so let's go ahead and get started. So first, I do have a disclaimer, and I'm sure you guys have all seen those commercials at the very bottom. They have that lawyer talk and you can't actually read it because it's too fast and too small. I'm going to read this to you so that you're aware of what this is today. So the information presented in this webinar is gathered from a variety of sources, all of which I've cited, all of which you'll get copies of. Please refer to these sources when making changes in your decisions. Making changes and decisions for your practice. My intent with this webinar is to inform you of the changes and the resources available to you at this time to the best of my ability. My opinions are mine alone. I'm not an attorney. I'm not legal consult. If you need legal help, please contact an attorney. So I am basically just going to try to summarize everything that I've read and watched or absorbed or whatever. So that is my disclaimer for this presentation. So by watching this webinar, you acknowledge that you're agreeing to this disclaimer. Okay, so first, I do want to thank Dog Days Consulting for sponsoring today's webinar. Dog Days Consulting is a social media and digital media marketing company. They also help with reputation and brand management. So they're the ones that can help you with all of your social media, Instagram, Facebook, YouTube, bad Yelp reviews, encouraging good Yelp reviews, all the things that you can promote for your clients. So they're a wonderful company. Rhonda Bell and Linda Miller are the owners. And Linda is on the call right now. And I don't know if you guys can see her since my screen has taken over, but if you can, if you give a wave, Linda, maybe say something really quick so that your face shows up on the screen.
Hola, es Linda.
Okay, thank you, Linda. So thank you so much. Linda is moderating the webinar today, so she's going to be able to let everybody in and answer questions that you guys have. If you have anything, type it in the chat, throw it in there. Linda's going to answer whatever she knows the answers to. And I will be monitoring the chat. Well, I will be moderating. She's going to read it to me, but what I'll be doing is probably every 10 minutes or so, maybe a little bit later than that, I'll pause to answer questions. So if you have a question, throw it in there so that we can go back and review it and answer that question if you have that. I may or may not know the answers. There's things that changed. Literally, the state changed a rule yesterday. Orange County changed a rule on Tuesday, and LA County changed a rule on yesterday as well. So literally within 48 hours, I had 3 different county public health departments or state public health departments changing things. So this presentation is only as good as the second I typed it up. So just my disclaimer for that. Okay, so I don't know if you can see this because of the Zoom stuff. I know sometimes at the top of the screen is harder to see, but what I first wanted to briefly talk about is what is the ETS? What are the emergency temporary standards? You guys, a lot of you know this stuff and a lot of you don't. So I'm going to just briefly tell you what that is, and then I'm going to talk about the revisions to the ETS that take effect on January 14th. So first, the main goal and point of the ETS is so that you can communicate to your employees about what your COVID prevention procedures are. You also need to show how you're going to identify, evaluate, and correct the COVID-19 hazards. And you're also required to provide face coverings and respirators in the manner and circumstances associated with the ETS. So that depends on what type of company you have and where you are in the state. Now, the whole state does have masks, but LA County has different rules for the masks now. So we'll talk about that in a little bit. And two things I want to say before I go on is, one, this presentation is designed specifically with veterinary hospitals in mind and working in that type of environment. So if somebody else that happens to watch this on my YouTube channel, I'm not going to talk about human healthcare. I'm not going to talk about other industries. So if there's something that applies to you differently, I'm not going to approach that. So please just know that that's not what my intent is. And pretty much almost every slide, except for one, or no, the resources at the very end, every slide I copied and pasted the information from either California Department of Public Health, LA County, Orange County, or Cal OSHA. So I did not make up any of these words. I copied and pasted it. So I give them all credit, and I didn't make up anything for fun on that. So back to our ETS. So another point of that is to use your engineering controls and administrative controls and providing the PPE required for your employees. So you have to be aware of what you need to be doing, how you need to be doing it, and all the rules associated with that. One thing that's really important with the ETS is that you have to follow procedures and investigate and respond to COVID cases or COVID-19 cases in your workplace. And when it refers to COVID-19 cases, it's talking about positive COVID employees. It doesn't say employees, it just says COVID-19 cases, but that's what that means. So what else about the ETS? It's designed to provide COVID-19 training to employees. You are required to provide training to your employees, and that is the rule of the ETS. The ETS is kind of that mandate that tells us everything we need to know, right? You also have to make testing available at no cost to employees who have close contact as defined in the ETS with the person of COVID-19. And there's one slight word that I left off of this sentence that should be there, is for workplace exposure. Workplace exposure, you're required to make it at no cost. If they got it at grandma's house, you're not required to do that. So I apologize that that word workplace exposure, or two words, are not on that sentence. So what else are you required to do as part of the ETS? You're required to exclude those COVID-19 positive cases and potentially exposed employees from the workplace until they are no longer an infection risk. And we're going to talk about that in a little bit. Exposed employees who are fully vaccinated, we're going to talk about what fully vaccinated is now today. And if they have no symptoms, they do not need to be excluded. So we'll talk more about what is a fully vaccinated employee, but as of right now, or last night at midnight, you could allow your employees who are fully vaccinated but yet exposed to still come in and work, as long as they're not having symptoms. And we'll talk about that. So what else are you required to do as part of the ETS? You have to follow the return to work criteria. You have to follow the rules that California Department of Public Health has given us in order to know exactly what you should be doing. You have to maintain records of your cases and report illnesses to Cal OSHA and to the Public Health Department when required. So that's the nuts and bolts of what the ETS is, the Emergency Temporary Standards. This was first effective on November 30th of 2020. And then we made some changes to it in June of 2021, which I did a presentation back then. So some of you may have attended that and talked about what the changes were within the state, because the state opened up again. So they made some changes there. And they've also have their new revision and new changes that are effective on January 14th. So that's kind of your timeline. The majority of the items, I don't know what you call them, but the information presented by the original ETS in November, the majority of those are still true. There's just been some revisions to specific things. So what are those revisions? Before I start this revision, does anybody have a question on any of the things that I just spoke about that relates to the ETS protocols?
Melissa, we have a question in the chat box. It says, do we only report serious illnesses? If they have mild symptoms, then no need to report to Cal OSHA?
Well, from what I can tell, you're only required to Cal OSHA. I'm not talking about public health. That's a different topic, and we'll talk about that in a little bit. Cal OSHA, you're required to report death and amputation. For those of you who didn't know that, if you have anyone that dies at your hospital, you have to report that within 8 hours. Amputation, I don't know how much time you have to report that. And I meant to look that up before the presentation. So if there's anybody who happens to know what Cal OSHA's requirement is for amputation, please throw that in the chat. But you're not required to report to Cal OSHA unless they ask. At this point, and from what I could read, So if there's some tiny thing somewhere that says you're required to report it, I could not find it. And in the information that I have, they actually say when requested. So I don't know that you automatically do, except for the amputation and death. So that is something that I will say, if you have a death as related to COVID, which hopefully none of us do in our workplaces, if it's a workplace exposure, yeah, you're going to have to report that to Cal OSHA. Otherwise, I'm 99% sure at this moment, you do not have to report it to them, just public health. And we'll talk about that.
All right, what happens when an employee lies? So for example, you're doing your daily tracing and asking if any symptoms, and they just flat out lie.
Well, I'm actually going to talk about investigation down the road. So I'll re-answer that question at that time.
All right, then we have one more. How do we know which parts of the ETS are still in effect and which have expired?
Well, I will tell you. So most of them haven't really expired except for the sick time pay, but there's been adjustments to them. So we'll talk about what those revisions. Are there any other questions before I move into the revisions?
No.
Okay, perfect. So let's talk about what the revisions are. So the revision is that you're required to notify your employees. You were already required to do that. They just sort of tweaked and changed in how and what capacity you need to do it in. You need to make sure that you notify the employees in writing and within 1 day. And I'll read this to you. You must continue to notify employees and other workers at the work site if a possible COVID-19 exposure within 1 business day. So if you have a workplace exposure, you have to notify your team members within 1 day, and you have to do it in writing. And you can do it by email, you can do it by memo, however you feel like you need to do it, but it does need to be in writing. They sort of clarified that. Another update to the ETS revision was obviously the face coverings. I don't know if you saw this, but California extended the face mandate, the mask mandate until February 15th. So it will be now for another month. If you saw that or didn't see that, that's the change. There was a little bit of clarification on exemptions to the masks. So you can have employees that have exemptions to wearing the mask. They have a medical reason or a mental disability reason, some type of doctor note related condition that says their doctor says they cannot wear the mask, or they can't wear the mask for more than a period of time or something like that. They have a note from their doctor basically. And what Cal OSHA said is, all right, if that's the case, then that employee needs to social distance from the other employees, at least that's 6 feet. And they either need to be fully vaccinated or tested weekly for COVID-19. Now, the caveat to this is the testing is on the employer, not to do it, but to pay for it and to make sure that it's done. So employer has to pay for that test and pay for the paid time, which we'll talk about what that is. The employees are not required to pay for that themselves. So what else? Testing and exclusion. So one of the kind of changes, and I'm going to move my thing, I can see it. There we go. One of the changes to testing, previously, fully vaccinated employees were not required to be tested after close contact at work. Now they are. So it was only unvaccinated previously, but now your vaccinated employees, as well as your unvaccinated employees, need to be tested if they have close contacts at work. Not if they got it at grandma's house, that's not your requirement. Again, I'm only talking about workplace exposure that it's required. And again, at no cost and during paid time, which we'll talk about that in a little bit. So what else? Outbreaks. So outbreaks changed a little bit too. So there's 2 types of outbreaks: regular outbreak, which is 3 or more employees, and major outbreaks, which is 20 or more employees. And for a regular outbreak, you're required to make testing available weekly. For major outbreaks, you're required to make testing available twice a week. And this includes your asymptomatic, fully vaccinated staff, in addition to your symptomatic, anyone, and your unvaccinated. So pretty much everyone that's an exposed group has to get tested once if it's just a regular outbreak, twice a week if it's a major outbreak. The other kind of exception they talked about was employees who have fully recovered from COVID-19. So they had it recently within a 90-day period of time. And those who are fully vaccinated are required to be excluded from quarantine just because of close contact. Now, there are some rules about that I'm going to talk about in just a moment. But the good thing, I was a little nervous about that because they had said some stuff about making people that are fully vaccinated and not symptomatic stay home. And I was really happy to see that that was not part of the changes. So you can still have your fully vaccinated or previously confirmed cases of COVID that it's been within 90 days, they can come to work as long as they're not symptomatic. And there's some rules we'll talk about in a second, but that was kind of a good thing for us. So what is the return to work criteria? So Cal OSHA said to follow the California Department of Public Health's guidelines. So the guidelines that the CDPH put out is what Cal OSHA is telling us to follow to allow our employees to come back to work. And those guidelines were last updated on December 30th. From what I could tell, I went back to look today to make sure that wasn't changed, and it was not. Just the mask mandate had changed, but hopefully there isn't any changes. That's one thing I got to say. It's so hard to know that. If you guys are having a hard time and I'm having a hard time, we're all in the same boat. Okay, so let's talk about this return to work. So a COVID case, again, a COVID case is someone who tested positive for COVID. They may return to work when any of the following occur. They have isolated, they can come back after day 5 if symptoms are not present and are resolving, and a diagnostic specimen collected on day 5 or later shows a negative test. They can come back if they're, well, sorry, let me clarify. If they're not able to test or choose not to test and symptoms are not present and resolving or are resolving, isolation can end after day 10. So day 5, if they test negative and they have no symptoms, day 10, if they don't test, but they have no symptoms. If symptoms other than fever are not resolving, continue to isolate until symptoms are resolving or after day 10. So day 10 is kind of a magic number in addition to day 5. Day 10 is more of your symptoms or people who are not going to get tested. The other thing is you need to wear a well-fitted mask around others for a total of 10 days, especially in an indoor setting. Now, most of us are going to be doing that anyway, because that's what workplace is, but your employees should be aware that they should also be wearing the mask around others, even if it's at their personal time, but they're inside. If fever is present, that changes it. So that's the one symptom that it has to be gone. So the fever has to be completely gone in order for someone to, they can't have a lower fever, it needs to be completely resolved from what I can tell. Now, medical professional, if your MD says you can come back, that's up to them. That's totally different. I'm just saying from the rules that I've read, if they have a fever still, they still have to isolate until it resolves. Some of the other symptoms can improve. So if you have less of a sore throat, less of a cough, less of a runny nose, those types of things, you can come back, but you have to be done with your fever. And that's for your COVID positive cases that they may return to work for. Okay, so people who are exposed to someone with COVID, this is when they need to quarantine. This is what the quarantine looks like. So these are people who have been exposed. The rule is if you're unvaccinated or vaccinated and booster eligible, but have not yet received their booster dose, they're in the quarantine section. And I will talk about vaccinated booster eligible in a second, but just it's like 2 slides away. They have to stay home for at least 5 days. So again, this is your unvaccinated or vaccinated and booster eligible, haven't done it yet. You have to stay home for 5 days after your last contact with a person who had COVID-19. They need to test on day 5. Their quarantine can end after day 5 if symptoms are not present and their test was negative. So they can come back on day 6 if they have a test result and no symptoms and they're negative. If they're unable to test, then they have to wait till day 10 again. They still have to wear a well-fitted mask. So I think that's the one thing, the common thread from all of this. If anybody has exposure to someone with COVID, they need to wear a mask all the time around other people until after day 10. And obviously a mask in the workplace, that's already a thing. So I'm not talking about not wearing it after day 10 there, but in their personal life. So they need to wear it for a total of 10 days, especially when inside. Outside does differ, but if they test positive, so this is people that were just exposed. If they actually test positive for it, then you have to refer to the other slide that talks about what to do when you're positive. So this is only if they've been exposed and don't test positive. If they also develop symptoms after exposure, then there's different rules for that. That they basically follow the rules of positive tests, even though they may or may not be tested. If they have symptoms, you treat it the same. Okay, so persons who are exposed to someone with COVID that don't have to quarantine are people who are boosted. We'll talk about that, what that is in a second, or vaccinated, but not yet booster eligible. They test on day 5. They wear a well-fitting mask around others for 10 days. Again, that 10-day thing. They don't have to quarantine. So what I'm going to tell you right here, if you have fully vaccinated employees or employees who are not yet booster eligible, and they're not showing any symptoms, but they were exposed, they do not have to quarantine from work. They can come to work. They just need to test on day 5. Hopefully they're negative. If they show positive on their test, then they have to quarantine and follow those rules. If they're negative, then they're okay. They just need to continue wearing the mask, okay? If they start developing symptoms, again, they have to stay home. So they don't have to quarantine at all. You can have them work on the next day if they were in this criteria of having the vaccine and booster eligible or whatever. Okay, so I know there's probably I see a lot of questions on this one. So I'm going to go into some definitions first because that may answer the questions, and then I'll go back and look at the questions again, okay? So what is booster eligible or fully vaccinated? So a fully vaccinated person is someone who, if they got Moderna or Pfizer, they got their first 2 doses. And then after 6 months, they became eligible for a booster and they got the booster. So essentially, if they have Moderna or Pfizer, they have 3 shots now. That's a fully vaccinated person. You can also be fully vaccinated if you had Moderna or Pfizer and you had your first 2 doses 3 or 4 months ago. You're not yet eligible for the booster because it needs to be over 6 months. So you can be considered as fully vaccinated if you have those first 2 and are not yet eligible to do the 3rd. So those are what is now considered fully vaccinated. And that was a new thing for me because I was not aware until researching for this presentation that if you were not boosted with that 3rd vaccine, if you had Moderna or Pfizer, you are no longer considered fully vaccinated based on the CDPH's guidelines. It's a little different for Johnson & Johnson. If you got the Johnson & Johnson vaccine, you got your first dose because it's a 1-dose vaccine, you get another dose 2 months after the first dose. If you do that, and typically the people are getting the Moderna or the Pfizer vaccine the second time, that is only a 2 shot vaccine, to say like 2 boosters. You don't have to do a 3rd one for that if you had Johnson & Johnson the first time. That is now what's considered fully vaccinated. And I'm going to say this again because I was a little shocked to see, but I guess not so much, that you need to have been fully boosted or not yet booster eligible to be considered fully vaccinated. That's your team right now. We're going to talk more about how to confirm that information in a little bit. Okay, so more definitions so that you guys are all on the same page with me is an outbreak. So what is an outbreak? In a non-healthcare setting, and for the intent of this presentation, we're not healthcare because we're not treating humans. I know we're healthcare in the sense of animals, but we're not healthcare treating humans, so we're not in that category. So an outbreak is defined at least 3 or more cases of COVID among workers at the same work site within a 14-day period. It doesn't necessarily matter where the exposure came from, but you have 3 people within a 14-day period of time. You have to report that to public health. And it depends on your public health. I have a list of all of them at the end. So you'll have to reach out to them. Some of them is by email, some is by phone numbers. It's all going to be a little bit different. So you need to research that. If you have like your 3rd employee, so you have 2 people and then you get a 3rd, you have to report it to them within 48 hours of when you know, or when you have positive tests. And I will clarify, this is not someone who says they were exposed to COVID. This is someone who has a confirmed case of COVID or has symptoms and has a medical MD saying they need to stay home and treating it like they have COVID. That's when you have that on your list of exposed. So if they have the outbreak. If they know someone who has COVID and they were around them but not tested yet, that's not part of the reporting requirement until you have the set answer. You must also continue to notify public health if you have more people that test positive. So as they keep coming, if you still get more within that period of time, and I'll talk about the period of time in a little bit, then you have to report those additional people as well. Now, if you're assigned a person from public health, they'll help you with this. I know a manager who had a break recently. I don't know if he was able to attend the webinar today. Eric, if you're on, please feel free to unmute. But he had to deal with it. He had a person assigned to him and they're walking him through all the requirements of the reporting because he had, I think, 6.
I'm here.
Oh, perfect, Eric. So Eric's going to speak for Orange County and his experience only. So why don't you tell really quick, share with what you've had to deal with as your outbreak.
So we actually got reached out after our first employee, and she verified it was a workplace employee, so on and so forth. Ended up that 9 employees had to be quarantined, 6 were positive. She actually had me updating and uploading timesheets to prove those employees were remaining off work. I had to complete an investigation. I had to do testing weekly, so on and so forth. And unfortunately for us, this all happened before December 31st, so we were still under the 10 days. So the unfortunate part was my staff who tested negative at day 5 were symptom-free, had to still quarantine for 10 days because they had a direct exposure with symptoms. Now they can test negative at day 5, return at day 6, and they're making it very clear they want that to be an antigen test now. Because you can remain PCR positive but antigen negative, kind of like a shedding Giardia dog. So that was kind of my experience, unless you want me to elaborate more.
No, thank you for that. I appreciate that. Why was it at one employee that you were considered an outbreak?
We weren't considered an outbreak,
Oh, okay.
but I was contacted by the investigator at that point. And she said, if you get any more cases, let us know. And then in the next 48 hours, it went from 1 to 6. So I notified her, and then we got assigned an official outbreak case number, so on and so forth.
Gotcha. Okay. I did have a practice owner ask me recently, what if I don't want to report to public health? I'm going to tell you, don't not report. You have to report. And I know it's been difficult for you, Eric, and I'm so sorry, but have they been nice to you? Like, what was your experience with working with them other than you have to jump through hoops?
Yes and no. Initially, they were very nice. She started out a little aggressive because she, I hadn't reported it, but I said this was only one case. So by the time I reported the additional cases, it became a little more friendly. The difficult part was with the ever-changing guidelines that have now changed, 3 times in the last 3 weeks. The representative said, feel free to reach out to me via phone or email anytime. You have my direct extension. I'm happy to answer your questions. I would email her a screenshot of a very confusing guideline, and she would literally just screenshot that screenshot back and highlight the section. And I would respond with, that was what is confusing. Can you please explain? Can you please call me? She basically would say, no, you can't call me. I did successfully get through to the helpline. It took about an hour on hold, and spoke to an RN with the Orange County Healthcare Department, and she was actually very helpful in clarifying. But they were somewhat friendly, and then got a little dickish at the end.
Well, hey, no, I mean, I'm glad you didn't say they were not friendly at all. At least that's somewhat reassuring. So everyone listening, this is your point. You got to report it. If you think you have it, report it to them. If you're unsure if you have the outbreak, report it to them anyway, and then they can help you through that. Because if you do have it and you didn't report it, I guarantee there'll be penalties and consequences to that. So I'll go over the infectious period and then the 2 other things, and then I'll stop for questions. So what is an infectious period? So the infectious period for COVID is basically 2 days before they're contagious and infectious 2 days before they show symptoms or before they submit their specimen for testing if they're asymptomatic. So what this means is this: if I don't feel well on Monday and I decide I'm going to go get a COVID test because I have symptoms related to COVID, I go get the test. It's a 2-day test. So I get the results back on Wednesday. So I'm positive. I was infectious 2 days before Monday, not Wednesday. So Wednesday is just the day I got the results, but the day I submitted the specimen was Monday. So I was infectious and contagious on Saturday, the Saturday before. If I didn't have symptoms, but I got tested because of a workplace exposure or because of another exposure, or maybe I was going to go to a concert and I had to get tested to do that or something. If I tested positive on Monday, or I took the test on Monday and got the results back on Wednesday, again, it's 2 days from when I submitted the sample or the specimen. So it's 2 days backwards is when you have to look at it. So the importance of that, and the reason I kind of want you guys to think about it, is when you're doing your contact tracing and when you're looking at your employees to see who's been exposed, you have to use the infectious period as part of your timeline. So it's 2 days prior to feeling symptoms or prior to the specimen date of collection, and up to 10 days after the date that you got the specimen collected or the date that you first started showing symptoms. So that's the timeline that you need to look at to see who worked with that employee during that time period. I highly recommend that you have an Excel spreadsheet to track all of these things. And you literally track exposure date, test date, the result date's good, but that's not applicable to determining the infectious period. But that's what you're going to do to determine which ones of your employees were exposed to that person. If that person last worked on Wednesday of the week before and they know they were infectious on Saturday, then your team is not considered, they're not considered a close contact and they're not considered exposed because it was the Wednesday and Saturday was day 2, or I'm sorry, the first day that you would consider in the 2-day period. So that's important for you guys to think about. I know it's a little confusing. I've had to read it and re-say it multiple times so I could make sure it made sense to me. So if you have questions about that, I can definitely restate it, but it's basically 2 days before they show symptoms or 2 days from before their, or when their specimen was collected, up to 10 days after specimen collection date, or up to 10 days after they show symptoms. Okay. Those are the things you need to pay attention to. So last slide, and then I'll have questions. So what is a close contact? I think most of you guys are kind of aware of this because they talked to us about this repeatedly. A close contact is you're within 6 feet of someone for a cumulative total of 15 minutes or greater within a 24-hour period of time. That's what a close contact is. So if you saw someone for 1 minute and didn't see them again for a week, then that's not close contact. But if you spent the day with them, whether you were next to them the whole time, if you spent at least 15 minutes within 24 hours, that is close contact. And then what is, and I'm sorry, I'll go back. So that's if that person was in their high-risk exposure period. So what is the high-risk exposure period? It's pretty much the same as when they're infectious. So that high-risk exposure period is that 2 days prior to them having symptoms, or 2 days prior from the date of specimen collection up to 10 days after. So when you see high-risk exposure period or when you see infectious, those are sort of interchangeable. So when they talk about close contact, you need to have that close contact with the person who's now showing positive for COVID within their infectious period. So it's within that 2-day to 10-day period of time. Otherwise, it's not considered close contact if it's outside of that range, okay? All right, so I'll stop here and then we'll go into the next definition. So Linda, are there any questions on there that I haven't answered or that you want to talk to me about?
I believe there are a lot of questions, but bear with me if I miss your question. I pre-apologize. There were a lot of very good questions and I think you covered some of them, but not necessarily all of them. So I'm going to kind of scroll up and go back to some of the ones that I thought were exceptionally good questions. I mean, they're all good questions, but let's see here. Let's go to, let's see. So did you answer for the outbreaks? It says to report to local health departments. Who exactly is the local health department?
Your county or city public health. So if you're in Southern California, we have a few. So we have Riverside County, San Bernardino County, San Diego County, Orange County, LA County. If you're in the city of Long Beach, we are in LA County, but we actually have our own public health department. So I would reach out to Long Beach Public Health. If I'm in Pasadena, Pasadena has its own public health department. So I would reach out to Pasadena. If I'm in Ventura, Ventura has their own public or their own county public health department. Outside of that, when you get into Northern California, I did not look that up, but I do have a link to all the public health departments in the state of California in my resources, so you can all get a copy of what that is. But you just need to determine which city, if you have a city public health department or just a county. You're not reaching out to California Public Health Department of Public Health. You're reaching out to your local county or city one.
Okay. What daily tracing is now required? Do they have to do daily temp checks, et cetera? And can the employee self-attest?
Well, you should, because it's part of having that protocol for COVID tracking, you know. Unfortunately, I found that the temperature checks, me personally, so many people didn't have a fever when they had COVID before the vaccine was available. So I don't know that I would rely on that as a way of guaranteeing that someone doesn't have COVID. But if you're already doing that protocol, then you might as well continue to do it. If you've never done it, but you think it could be helpful, it is a way to prove to Cal OSHA that you're trying to comply with required safety and hazard procedures. But I didn't see one that said you specifically had to. But again, there's so much information that I don't want to be wrong. So I'm just going to tell you, you should probably do it as a precaution, even though I personally hate it. So.
All right, can you define possible exposure?
We're going to talk about the exposed group in just a moment.
Okay, good. And then exclusion pay.
We're going to talk about that at the end. Please.
Oh, okay. Awesome.
Wait. That's my favorite topic in this whole thing. And please, if you can't sense the sarcasm.
And then Somebody says we're keeping rapid tests in stock at their clinic. Is that adequate, or are they required to do a PCR?
What county are you in? Because if LA County, and part of that information is that you need to have a test done at a lab or medical facility.
Okay. And then if you have less than 20 employees, does that mean you can never have a major outbreak?
I won't say never, because that could change. As of right now, you would not be considered a major outbreak if you don't have 20 employees.
And then do you have to test if exposed, or do we just recommend testing? And does the practice cover the cost? Didn't answer that.
Like workplace exposure?
Yes.
Yes, so practice covers the cost. I'll talk about that in a little bit when I do some more definitions.
And then there was another one here. Let me find it. Go scroll down. Okay. And then you discussed booster eligible. You went over that.
We did.
Okay, here's a good one. We have an employee who turned in a test result, but it didn't have their name on it. And it says TikTok is showing how to manipulate a test. The test should show the employee's name. Is that correct? Or can we ask for that?
Are you talking about like they did their own at-home test? I don't know the answer to that, because I have not required anybody to do an at-home test and submit it. I know some companies have, but I have not done it personally, so I don't know the answer.
Is there a 14-day wait period from the third vaccine or second for the J&J before you're considered fully vaccinated?
Yes, I'm sorry. I did not. I should have said that. I guess I sort of assumed, since that was like before. So yeah, it's still the 14-day period from when you have that last booster of whatever booster it is to be considered fully vaccinated.
Can we make them stay home for the 5 days, even if they're vaccinated, boosted, and exposed with no symptoms, just in case they end up testing positive as a precaution?
Again, you can do whatever you want as far as making them stay home, but if you do that, are you going to be required to pay them? Is it part of the recommendations from the state? Not at this time.
If an employee tests negative, but their doctor is saying that they're showing symptoms and it's suspicious and they're treating them as if they're positive, would that count towards the 3 employees?
Yes, because if a doctor says they're positive, now I'm going to say yes to you, and then you call your public health. And if they say they require an actual lab test that confirms that, then that's up to them. I don't want to tell you yes and then find out that that's not true, because I know that if a MD says that they need to stay home, that you have to follow that, and you consider them as exposed, like in your own mind, or I'm sorry, as positive. But whether public health might tell you something different, I don't know. You'd have to talk to them.
Okay, another third employee question. If we have an employee who hasn't been in the hospital because they've been on vacation since the 28th.
I'm going to talk about that.
Oh, you did? Okay.
So I will be talking about that in a minute.
They wanted to know if that was the third employee. Okay. And then report to Cal OSHA or DOH?
Reporting to Cal OSHA for what?
It doesn't.
Okay.
Say.
Well, you can throw that in there, and then I'll come back to it. So I'll go ahead and go on, Linda. And then if they ask that, is there any other questions before I go?
There are a lot of questions. What are considered symptoms? Do we have to look at the CDC website?
All right. So how about I will continue, and then I'll go back, because I know I'm going to be talking about some of these things in the future. So I'll just keep going, and then I'll come back to it. Okay. So what is a common definition of exposed group? So what is an exposed group? So an exposed group is an employee's at a work location, a working area, or common area at work where an employee, COVID cased, so again, that employee test positive, was present at any time during their high risk exposure period. Again, that's that 2 days before up to 10 days after. A common area at work includes bathrooms, walkways, hallways, aisles, break rooms, any eating area, and waiting area. A place where people only momentarily pass while they're walking, while everyone is wearing face coverings, without congregating. So they don't stop, they just keep moving. So like on an escalator, we're all going on an escalator. We're not stopping, we're just keep moving. We're all wearing masks, that kind of thing. Is not considered a work location, a working area, or a common work area at work. Now it's a little confusing, because in the other sentence, it says that walkways and hallways are considering a common work area. But if someone just passes there once that time a day and they don't go again, I think that's when it's saying it's not considered like a working area or a walkway or whatever. There's so many W's on that, I can't say that sentence more than once. So what else is it considered exposed group? If the COVID-19 case was part of a distinct group of employees, meaning that say you have an overnight shift and a day shift, if one of the people from your overnight shift gets COVID and exposes everybody on that shift, right? but none of the day people were in contact with the exposed person. So the person, I'm going to call them person A. Person A tests positive for COVID. They've exposed everybody on their shift that they've worked with, but they have not exposed anybody on the other shifts because they did not work with that person directly. That's when they're not part of that distinct exposed group. A lot of hospitals, people all work with each other, so it doesn't apply. But if you have an emergency facility or specialty hospital, it might. So if you have different shifts that never come in contact with one another, that exposed person, or I'm sorry, that positive person did not expose the other groups. I know there's like, oh, but what about COVID was in the air? So we're going to talk about cleaning. There may be cleaning requirements that you have to perform when you have a person who tests positive for COVID. But if there is no direct close contact, remember close contact as defined by being within 6 feet of someone for more than 15 minutes in a 24-hour period of time. If you don't have that close contact with that person directly, you're not considered exposed to them, and anyone that did not work with them is not considered exposed. So if you have a COVID case that visited a work location, a working area, common area, that did not stay for 15 minutes. So the best example, if you have an employee that comes in on their day off to pick up food, they don't stay for more than a couple minutes, just long enough to pick up the food and then leave. And then they find out that they start feeling sick later, or they test positive for COVID the next day or something. Because they were only in the building for a couple of minutes, they are not considered to have had close contact with anyone else. So the rest of your employees are not considered exposed if they were only in the hospital briefly. So if you have your mailman or UPS driver or whatever, if it's just brief, then it's not considered close contact. Okay, so I feel like it's in a future slide, but just in case it's not, if you have an employee that is on vacation and they're not in the building at all during the infectious time of someone who has COVID, they're not considered another like part of the outbreak. Or if the person gets COVID while they're on vacation and they don't come back to the workplace, that it would also not be considered an exposed or positive for an outbreak. Now, if you're at a threshold and you want to confirm that with public health, it's not a bad idea. But if they were not in the facility at all during that 14-day period of time, because remember, it's not that you have to report every case of COVID ever. It's only if you have it within that 14-day period of time. So if you have 3 or more people within 14 days, as opposed to you have someone on vacation and they're not going to come back, so they're all better, they were not in that 14-day window. Therefore, you don't have to report it. It's that 14-day window in addition to the close contact. Okay. So vaccinate, and this is one that's changed. So originally it was anybody who had been vaccinated with double vaccines and within that 14-day or after 14 days. Now it's changed, and I already talked about that. So can you require your employees to submit proof? Yes. And you can look up the information on the Department of Fair Employment and Housing. You can also look it up on the EEOC. May employers require employees to be vaccinated? And Cal OSHA said it's outside of their scope, and you need to look it up on the Department of Fair Employment and Housing and the EEOC. And I'm not going to talk about that at all, and I'm not going to answer questions about that rule. So you guys are going to have to look that one up on your own. Okay, so what is the employer required to do if they're not comfortable asking their employees if they're vaccinated or not? So this is my recommendation. I recommend that you ask your employees if they're vaccinated. You're going to keep all this information confidential. Whether they tell people or not, that's their choice. But you're going to keep it confidential within your own. And the reason I recommend that you know your employees' vaccination status is because there's so many rules that change depending on whether they're vaccinated or unvaccinated. If they don't want to tell you their vaccine status, you treat them as unvaccinated. If you don't want to ask them their vaccine status, then guess what? You have to treat them as unvaccinated as well. So if you have a team of 15 and you don't want to ask them if they're vaccinated or not, then guess what? All 15 of those people are now treated as unvaccinated in the event of exposure. So I really highly recommend that you do ask them. They don't have to tell you. They can say they don't want to tell you. Fine. Then you now know that you treat them as unvaccinated. But I do recommend that you ask. You need to keep that information confidential. We're going to talk about record keeping at the end, talk about the rules for that. But you do need to keep it confidential within just the leadership team, whoever needs to know, which may only be 1 or 2 people. So after asking about the employee's vaccine status, how do you document it? So I talked about this the last time I did this training the first time, but this is what you can either look at their information and photocopy it, keep it in their file. You can look at their information and log it, or you can just ask them to self-attest. I'm more of the middle one where I look at the information and I send it to my practice owners I work with, that I tell them, okay, this person showed me that they were confirmed, and I list the dates of their vaccines. The last time I was doing it, before I need to now do it again for the booster, was pre-booster. So I was only looking at, 2. I wasn't looking at more than that. So you need to go back and do that. So that is one thing that you need to do now, is because now that you know that someone is not fully vaccinated unless they have 3 boosters, or they're not yet booster eligible, or they got Johnson & Johnson and they only have 2 boosters, you actually need to now record that they've had that. Otherwise, you have to treat them as not fully vaccinated. So I don't want to say unvaccinated. I'm going to say not fully vaccinated. So you do need to log that and pay attention to that now. Okay, so common symptoms. I know that was mentioned. Common symptoms as of listed on the Orange County Public Health Department: fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. So that doesn't mean that's all of the symptoms. Those are just very common symptoms that are being reported as someone who has COVID. Okay, so I know we're getting close to being on the webinar for, almost like 50 something minutes right now, or almost 50 minutes, and we still have a bunch more to cover. So I'm going to try to blast through this, and I may have us do the questions at the end. If you don't get to stay on the call long enough to see your question answered, feel free to email it to me. I don't know if the questions will show up in my recording I don't think they will on the YouTube channel. I'm sorry. So I'll try to see if I can put some answers and some information. So we'll kind of figure that out. But I want to keep going, so I'm not going to stop here for questions. Okay. So what were the original rules? Have a written COVID plan. So you don't have to raise your hand or anything, but the written COVID plan was required in November of 2020, November 30th. And if you know you have not written a COVID protocol plan, you need to. It was required over a year ago. Cal OSHA has a lovely template on their website. I will send a copy of the template out with my email when I send all of you the slides and the link to watch the video, as well as some other handouts too. But you do need to have a written COVID plan. So if they ask you, you can show them what you're doing. You can have the very, very thorough one that's modeled after the Cal OSHA one. And then I recommend that you have updates too, because things change. So you may have multiple COVID plans. Have a binder. Put all of your COVID information in the binder, except the medical and personal information for your employees. You don't want that in there, because your binder should be accessible for your team to read and review when they want to. And you don't want to put the medical information in there, but you do need to have that. And in the protocol, it should include how to identify and evaluate employee hazards, exposures, both exposures and hazards, implementing effective policies and procedures to correct unsafe working conditions if you find some, like people putting up plexiglass because they found that was really important to do, allowing adequate time for hand washing. And this is something that a lot of us in our field wash our hands a lot anyway, because you're dealing with gross stuff. So you're dealing with different pets, and you're trying to, so that's good. But if for some reason you have shifts or groups of people that aren't washing their hands as frequently, you want to encourage it. You want to make sure you don't discourage washing hands or going to the bathroom frequently or whatever, because it is something that you're actually required per Cal OSHA to allow for that time period. Common symptoms and information about COVID-19, you want to put that in the plan. And again, that might change because they keep adding symptoms. All employees need to be trained on your COVID plan. I think that you should have them sign a document that says they were trained on it. And every time you do an update to the plan, guess what? They're going to sign again that says, okay, I got the update, so that you're always staying on track of the training for your employees. Okay, so rules that remain unchanged: masking. So you need to provide masks to your employees. If they ask for an N95 and you're not in LA County, then you need to give it to them, but you're not required. If you're in LA County, as of January 17th, you're required to either provide a N95 mask or a well-fitted medical or surgical mask. So you are required to do that. Otherwise, you're required to provide masks to your employees if they ask. If they don't have masks, it's required. I would make sure you have your own supply to constantly give them masks, whatever you guys want to use, because they have to be wearing them. So if they don't have their own, provide it for them. Don't make them wear their own. If they want to and they're not in LA County, they can, but I wouldn't make them get their own. I would provide it for them, just giving it as an option. Okay, so you also need to make sure you do adequate ventilation. I'm not going to go into that detail. There's a whole thing about your requirements for your health, your air conditioning, all that. Their recommendation that they give is to preferably outside air, which we obviously can't do because we're not going to deal with that with our animals. We don't want anybody escaping. I recommend, if you're not sure about your unit, Maybe talk to your air conditioner company to find out if it meets the qualifications, or get an air purifier. I have one hospital that has an air purifier in their exam room and their lobby and all their exam rooms actually, and it's super helpful. So honestly, they're not that expensive. It's not a bad idea to do it. And then you can show that you're trying even more to provide help. And then you need to make sure that you're still investigating all cases of COVID in the workplace and documenting that. And we'll talk about investigation in just a moment. Okay, so testing. Someone had a question about testing. So testing must be provided in a manner that's confidential. You're not going to yell across the floor, hey, Joe, since you tested, since you're sick, why don't you go test it? Like, you want to make sure it's confidential. You're not required to take them to their testing or to set up appointments for it. You're just required to give them information about where they can go. So I strongly recommend that you go online, and I did not put testing information in the slides, but I can put them in the resources when I email this out so that you know what common places are people going. Like, there's COVID Clinic, there's Carbon Health, there's a bunch of different places that do the testing. You just have to give the information to your employees if they need it. That's what's required to you. You don't have to do it or enforce that too. We're going to talk about that in a second. So what if, I'll do this. I thought it was the next slide. Sorry about that. So we're going to talk about what if an employee doesn't want to get tested. We'll do that. I think it's the next slide actually. So, but one thing you can do for testing, you can ask your employees to go to a free testing center. However, you still have to pay them their wages for their time to get tested, as well as travel time to and from the testing site. It also can include reimbursing employees for travel costs, such as mileage, or if they took Uber or a bus or something like that. So you can totally do the free testing at a free testing place, but you have to pay for the employee's time. What does paid time mean? So employer must make testing available during paid time. So that just means they get paid to do it, right? It does not have to be during their work shift. It can be outside of that. So say you find out, and this is also just for workplace exposure. This is not because they told you they got COVID at their grandma's or they were exposed then. You're not required to pay for testing for your employees if they were exposed somewhere else and you know that and they tell you that. You're only required to do it if they're exposed at work. So you can if they test, you have an employee that's off and they're off on Tuesday, and you get notified by another employee that they've tested positive for COVID. And the employee that's off worked with that employee the day before. So it's when the infectious period. You can ask the employee that's off, notify them of their exposure, and then send them to get tested. It doesn't have to be during work time as far as like their hours of work, but you pay them to do that. So it doesn't have to be during their work time, but you pay them regardless, whether they're at work or whether they do it separately. So I just want to make sure you guys understand that. But it does not have to be during their working hours. And that's kind of important because I know not everybody has been paying their employees to go get tested. If you haven't, you need to start. If it's workplace exposure, again. If an employer offers a test at no cost and they don't violate the regulation, but the employee decides not to do it, right? If there's exposure, you have to follow the exposure rules with a quarantine and all of that, but you're not required to force it. And you don't even have to have them sign something per Cal OSHA. This is again, copied and pasted from their site. You don't have to have them sign something that says they didn't do it. You just have to offer it and document it if they say no. You need to make testing available, but again, you're not required to enforce them to do it. If they don't want to do it, then you can either treat them as, the exposure, like how we talked about earlier, or you can consult the EEOC and find out if there's something else they would recommend. You're required to offer testing. You're not required to enforce testing. Okay, so non-outbreak. So when I'm talking about non-outbreak, this again means that you don't have the 3 or more people. So if a non-outbreak setting was an employer determined, how does an employer determine which employees may have had close contact with a COVID-19 case? So this is what you have to start considering. You do your contact tracing, right? And you look at, were the employees within 6 feet of the positive person for that 15 minutes and 24-hour period of time? And you want to kind of look at that. And then during that 24 hours of time, but also during that positive person's infectious period. So you want to kind of look and investigate your employees, right? So say you have a kennel person who never goes into main treatment or for very minimal, if at all. If you have a kennel person that tests positive for COVID, but they never go into main treatment and they don't reach the the criteria for being considered a close contact. Even if that person tests positive for COVID, if they don't reach that criteria, they're not considered a close contact for exposure, right? So that close contact, again, 15 minutes within a 24-hour period of time in their infectious period within 6 feet of them. So if they don't reach that close contact status, you're not required to, consider them as exposure to everybody else. So you do want to investigate every single incident. It's a pain in the rear. Like, I totally get you guys right now. I feel bad because I know what you're going through. But that's what you have to do. Every single individual, you have to treat individually, investigate them as an individual, and get all the answers to who they were around, for how long they were around them, were they masked or not masked, although that masking doesn't make a difference if they were within the close contact. It does if they're just walking by, but it doesn't if they were within the close contact. So non-outbreak again. So let's talk about, who do you notify? So you notify all employees and employees representatives who may have had close contact. If you determine that they have had close contact, and I swear that word is driving me crazy, if they've had close contact with the COVID-19 case within 1 business day. So if you do your investigation off of the person who was positive, and you determine that maybe 2 more people were potentially exposed to them, then you have to notify those 2 people within 1 day of when you found out about the exposure, or I'm sorry, about the case, the positivity, I guess. You have to offer them testing and paid time. We've already talked about that. And there is some exceptions to that. The exception is someone who had COVID recently within that 90 days, and they're not symptomatic, and they don't have to be tested or quarantined. Vaccinated people do have to be tested. They don't have to quarantine if they're not showing symptoms or if they don't test positive, but they need to be tested. Okay, so who else can you exclude? You can exclude from the workplace people who test positive. So when I say exclude, I don't mean that you don't have to do something with them COVID-wise. What I mean is you don't allow them to come in. So if they test positive for COVID, then you don't allow them to come in. You exclude them from working in your hospital for the periods of time required based on whatever, the 10 days, the 5 days, their testing status, symptom, all that. So I'm not going to go into that, but you do have to exclude from workplace people who test positive. You have to exclude employees after a COVID-19 close contact unless they were fully vaccinated before the close contact or recently recovered from the COVID-19. We've talked about that a lot, so I'm not going to keep going into detail. Some of this stuff is sort of repetitive, but it's said a little differently. So I kind of want to go over it, make sure you guys understand. And it is very confusing. I only understand this even remotely because I've been studying it for a few weeks. So if you're confused by what I'm saying, I'm so sorry. So following the return to work criteria for returning excluded employees to work, and you're following the guidelines given to us by the CDPH, which was at the beginning of the slides. So if you came in later to my presentation, again, I'm going to be recording this and sending this out to all of you guys. You definitely want to see the beginning because the beginning answers a lot of questions that you might have about criteria of quarantine time and isolation time and who to exclude and stuff like that. So please make sure you're checking that out. You also need to make sure you investigate exposure that address hazards, and you have to follow the record keeping requirements. So this is a little different, right? We're going to talk about outbreaks. So an outbreak is, again, 3 cases of COVID positive employees within a 14-day period of time within an exposed group. People that work with each other every day, and 3 of them test positive within 14 days. That's an outbreak. You must notify, well, I should have called public health first, but first, you need to make testing available to all employees who may have been exposed, and you've already going to do your contact tracing to determine who those people are. If they test positive, you're going to continue to exclude them from work. If they don't test positive and they're vaccinated, then it's okay. They can still work. But the rule is you need to keep testing all the employees within the hospital or the work location or work area to make sure that you're testing them to make sure that they're not positive or that they get negative or whatever. So you need to do that, you need to make it available. And you need to do this until the workplace no longer qualifies as an outbreak, and public health will give you the answer to that. So this is a little bit convoluted because public health is going to answer these things and may tell you to do something different, and you have to listen to them. This is the recommendations from Cal OSHA, but public health may have a different opinion. Obviously, Eric, if you heard him talking earlier, he had a different situation with public health. So you need to do whatever they say. Perform a review of your policies and procedures. If you have an outbreak, you need to look, is there something you can do differently, change some type of work environment workplace hazard, whatever. Is there something you can do that can make it safer for your employees? You are required to do that. And remember, you're required to document that too. Also, you need to look at whether you need to implement the ventilation changes. I'm not going to go into detail because I've already talked about that, but you do need to look at that as part of an outbreak procedure. Now, let's talk about major outbreaks. I know a lot of you won't have a major outbreak because if you remember, a major outbreak is 20 or more positive employees, employees who test positive for COVID. Sorry, I keep saying certain words and now I'm just getting tongue-tied. So it's 20 or more people. If you don't have 20 people in your workplace, guess what? As of today, January 6th, it's not a major outbreak. I have no idea if that's going to stay like that in the future. So as of today, you don't have to worry about that. But 20 or more cases of exposed group, did you notice it's within a 30-day period of time, not within 14. It's longer than just a regular outbreak. So you follow all the rules of a regular outbreak and you make testing available to all employees in the exposed group at least twice weekly and exclude positive cases and exposures until there are no new cases. And so when it's saying exposed group, that's everybody who is exposed. That doesn't mean that the people who are only positive have to get tested. It's everybody who is exposed. So a lot of us, that's going to be a lot of our hospital, but not all. Remember, you're going to do that contract tracing. That's going to help you figure that out. You have to offer respirators to employees. LA County has requirements for the mask that may be a little different, but it doesn't matter their vaccine status. And obviously right now the whole state's wearing masks. So for this moment, everybody's already doing it. But if that changes in the future, there's certain things you have to do mask wise for a major outbreak. And separating employees in the exposed group from other people, determining their need for respiratory protection. I'm not going to go into that, but that's depending on the situation and where they work. And the other thing is, a lot of people have asked me, like, when do I have to close? What's the magic number? Well, per OSHA, the magic number for closure is if you have 20 or more employees. That doesn't mean that that's always the true statement, because you could have 60 employees and 21 of them have gotten COVID within that 14-day period of time. Public health is going to help you determine whether or not you need to close. But you could have 5 employees and 4 of them get COVID at one time, and you can't operate. So you're not in a major outbreak, but you can't operate with just one person. So you may have to close as a result of that. So there's going to be different reasons for like different numbers of people getting sick that you might have to close. Could be a major outbreak reason. It could also be because you don't have enough people to stay open. So I don't have a clear number that this is when you're going to always have to close. You're going to have to evaluate your situation. And if there's any hazards you need to change that require something to be done that you can't do easily. Okay, so this kind of goes into how you calculate the outbreak timeframes, like the 14 days, the 30 days. I'm not going to go into this slide heavily because I know we've got to get through a bunch more. And I want you guys to kind of, if you have outbreaks, that's when you're going to need to look at this. But there is a way for you to measure how to determine if there has been an outbreak or major outbreak, and you look at the testing dates, any employee cases that cross over. So this is where you're, again, your Excel spreadsheet with your timelines is going to be really important to track who overlaps. That helps you know if you have this many cases, because you could have 3 or 4 cases of positive employees over 2 months and none of them overlap. And that's not considered an outbreak. It's only considered an outbreak if it's in a 14-day period of time, or a major outbreak when it's in a 30-day period of time. So you have to sit down and track, like, when did this person test positive? When did this person show symptoms or whatever? That's how you kind of figure it out. Okay, so one last thing it says on there is 3 or more cases outbreak requires to be just employee cases. Yes. If you have clients that have COVID, that does not count to your outbreak. But if you have a contractor or subcontractor, which we may have some, if you have like a groomer, they might be included in your employee COVID exposure outbreak thing, but not if it's like a client. All right, sorry, this is an investigation. So I'm going to answer this and then I'll stop and see if there's questions. We'll kind of pause there. But what you must do, you must investigate a COVID positive case and close contact in the workplace by doing the following. You determine when the COVID-19 case was last in the workplace, and if possible, the testing date and onset of symptoms. So we've kind of already been talking about that. You need to find out when they didn't feel well, when they tested, their testing date, and then obviously the test results, but that's what you're going to look at. Determining which employees may have been in close contact with that person, that contact tracing, okay, you do your timeline, you figure that out. You need to notify those employees within 1 business day that they were potentially exposed to COVID, and you keep the name of the person confidential. So I will say something on that. When you notify your employees that they may have been exposed to COVID, because we're such small practices, I guarantee you they figured out who the person was, because now that person's not in the office for 5 or 10 days, like they know, but you don't want to be the person that actually tells them the name, because they're still entitled to confidentiality. And it's actually in the rules that you have to maintain confidentiality of the person who tested positive for COVID. You just have to tell them they were exposed, but you don't actually tell them who they were exposed by, even though they'll figure it out. Okay, so employers must offer COVID testing at no cost to employees during paid time to all employees who had contact with COVID in the workplace, except for people who recently had COVID and came back and have no symptoms. Okay, investigating COVID cases in the workplace continued. Investigate the exposure and determine whether workplace conditions could have contributed. So you do need to do that. You need to do your due diligence. Always look at, is there something you can do differently? You're going to follow all the record keeping requirements that are required of you, whether it's Cal OSHA or public health or whoever. You're going to exclude the employees from the workplace who have tested positive, and potentially also those who have had close contact based on the close contact rules, based on their vaccine status. If they're fully vaccinated, they don't have to be quarantined unless they show symptoms, or excluded unless they show symptoms. You have to follow their requirements for preserving their pay and benefits, and you follow the return to work criteria for people returning to work. That is from California Department of Public Health. So this is a really good little slide, and it's going to be impossible for you guys to read. I totally understand. This protocol was actually written by a good friend of mine and hospital administrator, Elaine Myers. She made a flow sheet of questions, and I'll read you a little bit of it. I will send a copy of this to everybody when I send out the other information. So she asks, number 1, do you have any symptoms of COVID illness? Yes. If you have not been exposed to a known COVID positive person, you may return to work when your symptoms have resolved. Second, if you have been exposed to a COVID positive person, you must quarantine for at least 5 days until symptoms have resolved and you have a negative COVID test or doctor's release and return to work. If the exposure happened at work, the company will pay for your COVID test. If your answer was no, that you have no symptoms, then you move to question 2. I'm not going to go through the whole thing, but it's a really good flow sheet. Now, she based this flow sheet on Orange County public health requirements. It might be slightly different. Well, it is slightly different for LA County because the quarantine requirements are slightly longer, but it's a really good guide. So I will send this to everybody. It's a good, easy thing. Do you have this? If this, do this. If this, do this. And I think it's lovely because there's a lot of information on that. Okay, we'll go ahead and pause here, and then we're going to talk about exclusion pay. So Linda, hit me with the questions. And I know we're way over on time already, so if you need to leave, it's totally fine. This recorded session will be sent out and you'll get all the slides out of the way.
Yeah, I did want to remind everyone that they're going to get a copy of the slides and a copy of the video in case we didn't answer your questions specifically. They'll be there. And then also we have a copy of the questions. So if there's some that Melissa needs to personally email you, she'll get those to you.
And I won't be able to know who asked me necessarily. I don't know if it'll tell me that. So I may just answer the questions in the big email that I send to everybody.
Sure. Yeah, that's great. Okay. I wanted to see, someone asked what the responsibility is to notify clients following a confirmed exposure, or is it staff only that they have to notify?
It doesn't, it says employees, and then it clarifies like who's not an employee. Like it doesn't say you have to notify your customers. Because if you think about it, if you went to Target, does anyone tell you if they're exposed to someone at Target? It doesn't clearly answer that. So based on what I've read, it's only addressing notifying your exposed employees.
Okay, regarding the confidentiality notice, what happens if you have to ask employee 2 if they were around employee 1? Then that kind of breaks the...
Well, I would focus on asking employee 1, whoever tested positive, who were you around? I would focus on just asking that person, because otherwise, and it's so hard for us because we have like so many hospitals have like 10 or 11 people, like we know, but I would focus on asking the person who tested positive instead of other people.
Okay, getting a test might be difficult to come by, so they might have completed quarantine by that time. What does keep testing available mean? Does that make sense? So if they're unable to get tests, and how would they?
Yeah, so from everything that I've read, if you are symptom free, doing or improving, your symptoms have resolved, and it's been over day 10 or 10 days, you can come back to work. It's if you're trying to come back to work at day 5 or day 7 for LA County, which I'll talk about in a second, that's when you have to get that test to be able to do that. But from everything I've read, if you're symptom-free or resolving symptoms, or you never tested positive for COVID to begin with, you can come back after day 10.
Okay, I think there's a lot of very good questions, but
I know
most of
they're
them
gonna
are
be
covered.
too, and I always feel so bad. I'm like, I don't have time to answer everybody, but I would love to.
So if compensation you said is required for testing to take time off to test, or if it's their off day, you have to pay them for their time to go get tested. Is there a separate pay column on payroll? And what should it be classified under?
I haven't seen that. I know before when we had the FFCRA leave, there was like a certain code that payroll companies were using. I would ask your payroll company if there's something that they're doing to record that, and then maybe kind of come up with them like what you'd want to call it. And it doesn't address that as whether you have to do it or not, because it doesn't really talk about that specifically. I would think and before you did that because you were getting payroll tax credits for giving out the FFCRA leave, so there was a reason to do it. I don't know if there's the same reason from that angle, but honestly, it's a good way to prove that you did it. So you could come up with your own code if your payroll company doesn't already have one. I don't think you're required, but it's not a bad idea to do.
And then I think in the interest of having you finish the slides, we can answer these questions
Okay.
either at the end or.
And feel free, if you want to stay, I'll answer anything. You guys can stay on just because even when we finish, you don't have to leave just because the presentation's over. So, okay, exclusion pay. So I will be honest, I was not aware of exclusion pay until recently. Thank God none of my practices were in the need to use this. Otherwise, I would have had egg on my face. But exclusion pay, I'll read you the question. It says, if an employee is excluded from work because of workplace exposure under the ETS, is the employee eligible for exclusion pay? And the answer is yes. If they're excluded from work because of COVID-19 exposure, they should receive exclusion pay if the employee was not assigned to telework, so they weren't working from home, or the employee was not receiving disability payments or workers' comp payments during that time period. So those are the kind of two exceptions. Otherwise, if you have a workplace exposure, confirmed, proven workplace exposure, that someone is now required to quarantine, excluded from work, then you have to pay them. Is the supplemental pay, paid sick leave, still in effect? I put this in here because there was people who still thought the supplemental sick pay was still in effect. It ended on September 30th. I have not seen a resurgence of that. Whether there is or not, I don't know. But at this time, there is not a supplemental paid sick leave that you can use to pay your employees and get payroll tax credits for at this time. Okay, so what are the rules for the exclusion pay? This is really kind of complicated. So, can an employer require employees who are excluded due to workplace exposure during paid sick leave? Or I'm sorry, because they're exposed to somebody with COVID, are you allowed to require them to take their California paid sick leave? The answer is, if you provide a paid leave policy that is separate, in addition to the paid sick leave policy that is required by California paid sick leave, the Healthy Families Act from 2015, you may require their employees to use that as a separate sick leave as permitted by law. But if you don't have a separate leave for them, then you are required to pay exclusion pay. I'm going to bet that the majority of us do not have a separate leave that you use to pay your employees. You probably utilize leaves like the California-based one, temporary disability, the CFRA or whatever. That's not included because the CFRA is not paid. So if you don't have this extra leave, you're required to pay your employees if you have to exclude them from work because of a workplace exposure. This only applies in a workplace exposure, okay? Does not apply because they got sick at grandma's. And poor grandma, I keep blaming her, but if they got sick outside of work, only if they're sick in work. And someone did have a question earlier about people lying, and I'll talk a smidgen on that in just a minute when we go through these exclusion pays. So how long does an employee with COVID-19 exposure or test positive for COVID-19 from the workplace receive pay while excluded from the workplace? So the employee would typically receive the pay for the period of time that they're excluded, which could be 10 or more days. Now, it used to be 14 and they've made that smaller. So that's kind of good, right? Because it could be anywhere from 5 to 10 days, depending on the situation with their quarantine requirements and stuff. But if they're out of work for more than the standard exclusion pay period based on a single exposure or positive test, but still does not meet the regulations requirements to return to work, the employee may be entitled to other benefits, such as temporary disability or regular disability. Supplemental paid sick leave, but no, that's no longer in effect. So I sort of put expired now. So there may be other things that they can get in addition if they're going to be out longer than, the required time. So kind of an example is if they get sick with COVID and then maybe they have something happen as a result or whatever. I don't really know how to explain when it's saying they maybe have to stay out longer, but if they have to stay out longer for something different or they can't come back, that's when it could be part of that. What rights do employees have if their employer retaliates them for requesting exclusion pay? I'm not going to talk about it, but I put it in the slide. Does an employer have to maintain employee earnings and benefits if the employee is unable to work because of reasons other than COVID-19 at work? No, you're actually not required to maintain the earnings and benefits. You would follow the leave laws and stuff on that one. And that hopefully didn't confuse anybody else more so. If they get sick because they went to grandma's house, you're just going to give them their PTO if they have it or whatever they want to use, but it's nothing to do with you. You're not required to continue paying them. Now, you kind of have to look at your policies for like their healthcare and stuff like that. But if they're not on a leave, they're not technically protected for healthcare, not on protected leave. So it gets a lot more complicated. So I don't want to go into too much detail on this because honestly, I think it would just confuse all of us, but it is something to kind of be aware of. Okay, so if the employer can demonstrate that the employee's close contact was not work-related, they do not have to pay them. What does that mean? The ETS does not require employers to pay workers who are excluded from work if the employer can show that the employee's COVID-19 exposure was not work-related. In such circumstances, employers may have other legal or contractual payment obligations, but pay and benefits are not mandated by Section 3205. How does an employer show that a COVID-19 exposure is not work-related? Proving that this exposure is not work-related is 100% on you. You have to prove that they were not exposed at work. And you have to produce evidence. You have to conduct the investigation, produce evidence, and shows that the employee's COVID exposure did not occur in the workplace. If you can prove that that person is lying to you, then you can hold them accountable to disciplinary standards that you have in your handbook that says this is what you do if someone lies in the workplace or if someone goes against the standards and policies of the practice. You can follow that guideline. But I'm going to tell you, you need to be 100% certain and have 100% proof that they're lying to you before you go down that road. And you might talk to an attorney first before you go down that road too. But if you can prove it, you're not required to pay it. Okay, so how is the exclusion pay calculated? So this one's a little tricky because there's been a lot of discussion over the past probably 7 months about regular rate of pay. So the rate of pay for exclusion pay is the employee's regular rate of pay for a pay period in which the employee is excluded. A regular rate of pay, just for those of you who don't know, is not their hourly rate. A regular rate of pay is their hourly rate plus any additional income that they may receive because of work. So if you give them bonuses, if they've been regularly getting overtime, if they have a shift differential because maybe they usually do like an overnight on Tuesdays and so they get an extra hour of pay or something, you have to calculate all of those wages together to determine what their new regular rate of pay is, which is, like I said, it's not automatically their hourly rate. It might be if you never do overtime, you don't give bonuses, you don't have commissions or any extra things changing there, it could be their hourly rate, but it's not thought of as just their hourly rate. It's all of the income they could ever get. And usually you have to calculate it by reviewing like 30 days of their payroll to see like, okay, this is how much they made. And then you have to divide that into an hourly rate when you look at that. So you can determine how much to pay them for that week. But again, it's the regular rate of pay. And I'm sorry if I confused you on that. I just want to make sure you guys understood it's not automatically the same. And I highly recommend that you look up the definition of regular rate of pay if you don't know what it is. Okay, so The employees are entitled to exclusion pay depending on the length of the required exclusion period and how many days that they were scheduled to work during that exclusion period. And the employees must be paid no later than their regular payday of that pay period in which the employee is excluded. So you can't pay them 2 weeks later. You have to actually pay them like they were working, but it's not exactly that. So I would recommend that if you do pay exclusion pay for employees, that you do that, make it change so that your paid time because they went to get tested, you could call it test time or something. I don't know what you call it, but exclusion pay, I would 100% have a code for that so that you know that you paid exclusion pay to this person. So if anybody ever asks you, you can prove it. So make a code for exclusion pay and talk to your payroll company. They might already have one. Can Cal OSHA enforce the exclusion pay? This will make me laugh because of course they can. What if the employer does not exclude an employee from the workplace who is exposed to COVID-19? So to be honest, if they're required to be excluded based on the rules by the state or your local county or government or OSHA, if they're required to be exclude them. Don't have them come in because OSHA can come after you for that. If you knowingly allow people to come in who are actively sick and should be quarantined and should be sent home as a result of all the rules, and you let them come in, you easily could be fined a lot of money. So just don't make them stay home if they're in that close contact, all the rules we've already talked about. Can employees qualify for workers' comp? So this is an interesting question because can they qualify if they had a workplace exposure? We were originally told yes. And Cal OSHA says if they tested positive or were exposed and unable to work due to COVID at a workplace exposure, they could consider filing a workers' comp claim. And I talked to a workers' comp broker a couple of weeks ago, and he said, yes, if they have workplace exposure and they have to be excluded from work, that yes, it can be as a workers' comp claim. I've had 2 other brokers say differently. So I'm going to advise you all to contact your workers' comp company today and find out what their COVID workers' comp coverage is so that you know what you're looking at. Okay, so what pay or benefits may the employee be entitled to if they were exposed to COVID-19 outside the workplace? Obviously, they can use their sick time, vacation time, whatever they have that they want to use. And you can also offer them additional resources. And I put the link in there so you guys can give that to your employees. Okay, so now we've got the reporting requirements. So the record keeping and reporting. So there's a lot of this, but honestly, we're Californians, we are used to keeping everything. So it's not even like that different from what we're doing. It's just be structured if you're not already doing it. So you need to follow your state and local health department reporting requirements. You need to report your serious illnesses to Cal OSHA. And I mentioned that earlier. If you have anybody that dies, God forbid, because of a COVID exposure at work, you have to report that to them. Anything that normally you would have to report to them, you still have to report. You need to maintain the records. And the records of this would include your inspection documents, like when you inspected your facility to see if you were COVID compliant, if you had to change anything, whether it was outbreak related or not, like if you got plexiglass for the front, you want to document that you did that. If you got air filters for the exam rooms, document that you did that. Whether it was a correction or just a preparation, either way, do both. You also want to make sure you document your training. I'm telling you, have employees initial and sign everything that they were trained on it, because that's what you're going to need to give Cal OSHA if they come and ask. You need to have your written prevention plan available to employees and employees' authorized representatives, like if they, God forbid, they got an attorney, and then Cal OSHA if they ask. So you want to have all that stuff in a binder. What you don't want in a binder is the medical information about people's testing. You want to have that separate. That should be kept locked up and separate. And I know this is not on the slide, but I attended an OSHA talk last month that they talked about the confidentiality requirements of businesses. And I know it's different for us because a lot of us are smaller and we track our own records. But if you have a third-party company that's tracking your COVID information for your employees, you need to be certain that that company is not going to have a data breach or is completely confidential. You need to talk to them and find out what like their requirements are, how they're keeping things safe, because that was something they talked about pretty heavily in that talk. And I hadn't thought of it because most of us keep our own records in a filing cabinet. But if you have somebody else doing it, you need to make 100% sure that those records are confidential. So what things do you need to track? And I like this example because it kind of tells you what you might want to have ready for public health if you had to report it. And it says you need to have the employee's name, their contact information, their occupation and location where the employee worked, the date that they last worked on or the last day in the workplace, and the date of their positive test. And you're going to give that information to public health. They may ask you for more information, but that was kind of the basic. You may need to give that information to Cal OSHA if they ask you, and or the National Institute for Occupational Safety and Health if they ask. But you don't have to give it to the second two automatically. You may have to give it to public health if you have to report an outbreak. Otherwise, the medical information must be kept confidential unless it's required or permitted by law. Most of us know, unless you have a subpoena, then you don't have to give it to everybody else. I guess it depends on the situation, but in general, that's what that recommendation is. You also need to document employees that are not required to wear face masks, the ones that may have a medical exemption for it. They have a doctor's note. You need to record that, and you need to record what you're doing with that employee every week. So you actually need to record their testing if they're required to do that. You need to record their vaccine status. You need to document that you have this exception person and what that looks like. Probably you guys don't have people in vehicles. And now, since everybody's required to wear a mask, you pretty much have that. Previously, it was a little different, but you need to make sure that if you have any exceptions to mask wearing, that you have it documented. Okay, so we're almost done. We're so excited. I was really trying to do this in an hour. I guess that's impossible. There's so much information. So this is what I found updated as of the 4th from OC Public Health. I just kind of listed things. The isolation requirements were the same as the CDPH, which is in the first few slides. And the exemption and quarantine requirements were also the same as the CDPH, so that 5 days, if, you know, whether they're vaccinated or unvaccinated, whatever, that's in there. I'm not going to go over that again, but that is the same as that. The testing requirements were the same as CDPH, except they mentioned antigen test is preferred. It does say preferred, not required. So I know Eric was told a little differently from public health. They may have changed the wording to preferred instead of required in this last update that they just did 2 days ago. I don't know. I didn't save the first one. So that's what they're recommending, is they prefer antigen test. The return to work requirements are the same as the CDPH, and the face covering requirements are the same as CDPH. Now, LA County. LA County exposure or they test positive. This is updated as of December 16th. The isolation and quarantine requirements for those employees are the same as CDPH, that whole, vaccine, whatever. Again, I'm not going to do it. The exemption for quarantine requirements was also the same as the CDPH. The testing requirement was almost the same, except they say 5 to 7 days after exposure instead of just 5 days. They also say the test must be an FDA-approved viral COVID-19 test that is collected and performed in a healthcare setting or certified testing site. I was not able to stay on hold to confirm with public health if this means that if I want to test my potential exposure, workplace exposure, with a rapid at-home test at my hospital. I would like to talk to public health to find out if this means I can't do it. And I don't know the answer to that. I'm just telling you what their information says. It's indicating that you need to get an actual test at a facility. So I will get some answers for you guys and let you know. The return to work criteria is the same as CDPH. The face covering requirements, again, we've already talked about that, is being updated as of the 17th. Now, that was for vaccinated employees. For unvaccinated employees with exposure or tested positive, the isolation requirements are the same, except it says 7 full days since close contact, not until, it says 7 full days since close contact, not 5 days for people who are not fully vaccinated. So like it said 5 days for CDPH, and Orange County says 5 days if they were exposed, but it says 7. So even if they test, it still says 7. So exemption from quarantine requirements is the same as CDPH, those rules. And my internet might be unstable right now, so if you can't hear me, I do apologize. Testing requirements is the same as CDPH, except again, it's 5 to 7 days after exposure, and the testing thing I'm questioning. The return to work policy is the same, except it says 7 full days instead of 5. And I don't really know why it's different. It's just, they just do things differently. And then the face covering requirements as of January 17th are slightly different too. So yay, we're done with public health. So I just have a little bit of information. This information is from me. It's not in Cal OSHA. There are cleaning requirements if you have a positive employee. And I just wanted to give you a couple things. Serve Pro is a company that can come in and clean your facility. There are countless companies that can come in and help you clean it. I recommend the in-hospital cleaner, Euceria wireless spray, nano cold fogging machine. I have a link. I will send you guys all out the link. My good friend Elaine, who wrote the protocol checklist, she actually has used it. She's been using it for like a year. So if you have someone that tests positive, you can use it to help clean. You can even use it proactively to help clean surfaces and stuff. I do recommend that you have your facility deep cleaned infrequently, depending on your outbreak status. If you have an outbreak, public health might tell you to do it more frequently. They might give you more specific information. But in general, I would probably try to clean your facility a little bit frequently, which is where that machine can come into play. Okay, so now I have all the Cal OSHA and CDPH resources. I have LA County Public Health resources and Orange County, Long Beach, and Pasadena. I have San Bernardino County Public Health website. I could not find a lot of information on San Bernardino and Riverside, and I just kind of gave up at that point. So, but I did list the websites. I also have Ventura. All of this is Southern California. When I tried to go to Northern California, my brain just got overwhelmed. So I did list all public health departments in California. You just click on it and then you type in the first letter of your county and it pops up the name of your public health department. So other resources, Department of Fair Employment and Housing, which I referenced, paid leave resources for employees. I referenced the EEOC. Because when I send out the slides, my slides, you won't be able to click on the link. I will send out a PDF document that has all of the links on it that you'll be able to click a link and get to where you need to be, since it won't be necessarily accessible on the slides, but those are the links that I'll send you. Okay, any questions at this point, Linda? I'm officially done. It's an hour and 34 minutes.
There's quite a few questions. One of the ones that they got my attention was if they have employees over 100. Let me go back to that. What's the, is it required? Is it mandatory or?
Asking about the vaccines?
Yes.
Yeah, I'm not touching that.
No.
I don't know. I think so, because California seems to be not part of the lawsuit stuff. But as of right now, I keep getting emails every day about the update with the court, and I don't know the answer to that.
Okay, then
They don't know the answer to that. As I saw somebody, it said Linda or Lydia. Somebody raised their hand. I just saw it for a second.
let me see where we are.
Do you want her to unmute herself?
Yes.
Okay, go ahead and unmute yourself. I couldn't see if it was Linda or Lydia. Feel free to unmute to ask your question.
Okay, well, we're waiting for her. Do COVID cases?
Sorry, I just pushed the wrong button.
Oh, you're fine.
Yes, there she goes.
What's your question? Oh, you.
No, I pushed the wrong button. I was
Oh, that's so lovely. It's nice to talk to you. So thank you. Okay, go ahead, Linda.
Do COVID cases need to be reported on the OSHA 300A forms at the end of the year? You know anything about that?
If they're workplace exposure, I honestly, it doesn't address that, or at least what I saw. There's so many links that I did not click on every one of them, but I think that would be a good idea, especially if you're going to report it to your workers' comp. So I would talk to your workers' comp about it as well, but that is a good idea and a good question.
All right, and then real quickly, let's see here. I had a couple. We'll go through a hypothetical. If you're vaccinated with 2 shots, I guess that means no booster, no direct contact with a COVID positive, they were on vacation, not around them. Should they test immediately or should they wait the 5 days?
If they didn't have any contact,
No direct exposure. So
if you don't have exposure to someone who's COVID, I don't know why you would want to test unless you were, I don't know. I'm sorry. Maybe I'm not understanding the question.
I think it's a precaution, like
okay.
precaution, I guess.
Could be.
There are a lot of questions and I think you answer them in the beginning.
Okay.
So I would encourage, once everyone gets the slides, to kind of read through it again and see if that does answer your question. And if not, I have a copy of all the questions. And like you said, we can do a spreadsheet, or in the email, you can just answer each question.
Yeah, when I get the Zoom recording, it actually lists the chat separately, so I can actually see what all those questions were, which is kind of cool. And but I don't have any plans till about 2 o'clock my time. So if anybody wants to ask questions now, I'll open it up to ask everybody. I'm going to go ahead and stop my share. and to see other people are left. Well, there's still a good amount of people left.
And then,
So
Melissa, I'm going to have to take my leave of absence.
oh, you're good. Thank you so much for being our moderator today. Linda Miller, Dog Days Consulting. Thank you. Appreciate
Thank you.
you helping with this. So I couldn't have done it without your assistance.
Bye.
So if you guys want to unmute yourself, I don't want to have to check the chat. So please unmute yourself and ask your questions. And I will try.
Melissa, it's Kelly. Can I ask a quick question?
Yes, ma'am. Hello, Kelly.
Hello. Okay, so if this goes into effect January 14th, I myself am in the middle of an outbreak. I've got 4 positives and I'm waiting to see if there's 2 more positives today. Does this apply retroactive, especially on the pay?
We were talking about exclusion pay. That was effective in June, so that doesn't matter.
Oh, okay. Well, now that we're not us anymore and we're companion, I wasn't aware of that.
I honestly, I learned about the exclusion pay about 3 weeks ago, and I should have known. I'm kicking myself for not.
All I knew is that the other one had stopped on the 30th, and then I was all excited when I saw that California was doing something, but I didn't know that it was that.
The important thing, Kelly, is that you know every single one of those employees got exposed at work.
Yeah, they did. It was we kind of had them working in groups, and so group A all got it.
Okay, so if you know that without a doubt, then yes, I'm sorry. The exclusion pay is required.
Okay.
There's no benefit. There's no tax credit for that. It's just basically.
I know. Thank you.
Welcome.
Melissa, I have a question.
Oh, Chris, go first, and then the second person. I'm sorry.
So, it's we're required to notify in 1 day. Is it 1 day from when we're notified that they're positive, or 1 day from when they don't come to work because they had symptoms?
I would say so
Because I don't want to ensue panic.
No. And I advised someone recently, like, exactly, you don't want to assume panic. You're basing it on that positive test. I had another manager contact our Long Beach Public Health because she had questions for me of shutting down. I was like, honestly, I want you to talk to them. And everybody that had not tested positive yet, that was just sickish, the public health said do not count. So I would say, I would err on that. If they're saying they don't count as COVID positive until the actual test results, then yeah, you're not going to tell them until they get the test results back. The problem is that people not being at work that's going to trigger everybody to freak out either way, because they're like, oh, they're not in. But I would say you're not required until they actually have the test answers that you know they're positive.
Okay, thank you.
You're welcome. Who was the other person that had a question I didn't see?
Hi, Kristen Ignatski. How's it going?
Hello, good. How are you?
Hey, I'm okay. I just had a quick question. I may have missed it. That cold fogging machine that you mentioned. Can you use like rescue in that, or what do you use?
Oh, I'm so sorry. That's my fault. I meant to put that. So Elaine uses citricide. So I don't know any other cleaner that kills COVID. So if rescue kills COVID and it's safe to be in that machine, you could probably use it, but you probably have to read the information on the machine. But Elaine uses citricide at her hospital.
Okay, is that pretty readily available? Citricide?
I think so. She gets it from her janitorial company. I've never tried to order it, but I know she said she got it from her janitorial company, and it's CITRACIDE.
Okay.
And I meant to put that in the presentation. I'm sorry. I forgot.
No worries. Thank you.
Anyone else have any questions?
Hey, Melissa, I have a question.
Go for it.
Close contact, even if we're wearing masks in the hospital, it's still considered a close contact, right? Within 15 minutes?
Yeah.
Shoot. Okay.
Sorry. I know they don't have that exception. So yeah. And I feel like if say everybody wears an N95 mask, which I'll be honest, that would be the one mask that I would say, okay, probably could prevent more COVID, because they've done tests and proof that, there's just more minimal transfer of stuff. That would probably be the best. But as far as the rules, it doesn't say if you have an N95 mask, then you're exempt. I think partially too, because we're all humans and people take it down so they can breathe, or they take a drink of something or whatever. So I feel like that's even why, even if they're wearing masks 95% of the day, there's that 5% when they're not, for whatever reason. They sneeze or they, take a drink or whatever. So I think that might be why they don't make that exception.
Right. As far as having tests available, do you know of any practices that are actively like buying tests to have on hand at the practice, or are they sending people out? Because I was looking and I can't get tests for any of my staff until next week.
I don't know if anyone has I know that people have gotten them from Amazon. Amazon seems to be the place where you can get a lot of COVID stuff from, testing and masks and stuff too, but I don't know where people are actively, and I see that PCR positives that were rapid negative. So I don't know the answer to where everybody is getting their tests from. And I know that I've seen you can get a negative test on a rapid, but it's actually positive. So I honestly don't know where you'd get it. And I don't know if I'd recommend to do that first. I think it's going to be your own personal judgment. I mean, you're allowed to, unless you're in LA County, you're allowed to do it, but I don't know if I trust it 100%, although I have taken my own rapid test, but I don't know the answer to that.
Thank you.
Melissa, I have a quick question. Can you hear me?
Yeah, I can.
Okay. So what do you know, if or anybody else here knows, is there any other financial help a small business can use when they have to actually close, but they still have to pay this exclusion pay?
I know.
So they're not getting any revenue, unfortunately, but they have employees they have to pay.
Not that's listed on Cal OSHA, but the Small Business Association, they have a ton of resources. They may be a resource for you. So if you go to the SBA's website, they have all sorts of, they're the ones who did the PPP. They've done the EIDL loans. They did a bunch of loans. They actually do small business loans that you don't have to pay back for 30 years. The interest is really low. So I would reach out to the Small Business Association and see what they currently offer that could help you. It may not be specific to payroll tax credit cut type of thing, but I would see what your options are. And they do have a lot of options on there. I saw something that there's another PPP. I didn't research it, but I would look there.
All right, thank you. I appreciate that. Yeah, because our workers' comp has already told us that they may not be able to assist us. So it's great. All right, thank you so much.
You're welcome. All right, anyone else? And I'm sorry, I wasn't looking in the chat, so please just shout it out so I don't have to check it, because mine says I have a ton of messages. So anything else? All right. Well, thank you guys for coming and joining me today. I really appreciate your time. And I'm sorry that I was tongue-tied. Some of these words, saying them repeatedly, close contact, COVID, but it's difficult. So thank you so much for coming. I appreciate that you guys attended, and we're interested in listening to me chat about the worst topic in the world for an hour and 45 minutes. So thank you. Thank all of you for being here. So yes, thanks, Sandy. So yeah, thank you, everyone. Bye. I did take a few pictures of you guys, so I'll put them on my Instagram so you guys can see. Okay, bye, Jeanette. Have a great day. Enjoy.